There's 3 people there. Okay, can you see me? Okay. Thank you all for coming. A broken bone, an infection, or even COVID are all reasons why you could go to the hospital no matter the consequences. In order to even consider what type of payment you're going to have, you have to think about universal health care. You have to understand what the impact of universal health care will be on our finances, our quality of care, and our businesses. I'm studying to work in the healthcare industry, and I have researched extensively this past week on this topic. I also, like many of you, will need to use healthcare myself at some point, and most of us are on our parents' plan right now, but in a few years that will all change, and we need to understand our options now to make an informed decision later. This speech will evaluate the pros and cons of a universal healthcare system in the US through an explanation of the consequences, good and bad. So my first point is the financial cost of universal healthcare. A right to healthcare could lower the cost. With a single-payer system, the total public and private healthcare spending could be lowered by $1.8 trillion over the first 10 years because of lower prescription drug costs and administrative costs. This would help the overall public because paying for healthcare is a large financial burden in American homes. A 2018 poll pre-COVID hospitalization found that over 64% of those people delayed or did not use medical treatment. The same survey described how premiums have been drastically increasing in price over the past decade, so universal health care could decrease that cost. However, it is also argued that universal health care could increase spending for the US government and then in turn its citizens. The US government has already increased its healthcare system over the past decade. The universal healthcare was projected to cost $32.6 trillion over the first 10 years after it's implemented, and because of this, tax levels could rise for the American citizens. European payroll taxes that have universal healthcare, they average at about 37% versus the US at only 15.3%, meaning if payroll taxes double, it would make it harder for the average American to pay for their necessary bills. My next point is its impact on the quality and the availability of care. It could help improve public health and lower the risk for unnecessary deaths. Harvard researchers discovered that no health insurance could be associated with about 45,000 deaths per year and a 40% increase in risk for death for people that are uninsured. A Commonwealth study found that the US ranked bottom of 16 richest nations for preventable mortality because of a lack of quick and effective health care. A Lancet study found broader health coverage generally led to better care and health by looking at data from over 100 countries. US citizens are less likely to have a regular doctor and more likely to have unmet health needs and more likely to not receive their necessary medicine than Canadian citizens that have universal health care. Most people going to a hospital could mean longer wait times, and that could lead to less care. Medicaid is a federally funded healthcare system, and that was put in place in 1965 to provide care for lower income citizens, but a Government Accountability Office report showed that 9.4% of Medicaid users had trouble receiving care because of long wait times versus 4.2% of private coverage users. The average wait time in Canada with universal health care was about 60 days. In the US, it's about 24 for an appointment. A decrease in doctors also of about 100,000 is expected by 2030 by the Association of American Medical Colleges. Universal healthcare could increase this number, and doctor shortages will most likely lead to longer appointment wait times. This can mean someone is denied care when they really need it, and that they are paying for a service through their taxes that they're not receiving. My third point is that the universal healthcare could have a major impact on American businesses. For instance, healthier lives tend to lead to increased productivity. Researchers at the University of Colorado and Pennsylvania did a study that concluded workers with coverage miss an average of 4.7 days fewer than those that don't. Businesses also would not have to provide their own private coverage, so they could use that money to expand their business or to pay their employees more. Missing work and lower productivity is costly for businesses, so providing universal care could grow businesses and help the economy. Obamacare, another federally funded healthcare system, helped increase the number of self-employed Americans by 150,000 over 2 years, that was 2014 to 2016. With more people not worried about paying for healthcare, more can focus on doing what they love and starting their own business, which could help also stimulate the economy. However, universal healthcare could lead to the overuse of resources. When people have access to the system, they could fill up hospital beds and waiting rooms with maladies that do not need immediate attention or don't need attention at all. A study published in Science surveyed 10,000 uninsured people in Oregon who then went to go use Medicaid. 40% of them made more emergency room visits than before, even though US residents have guaranteed access to emergency care under federal law. With the increase in the number of people using resources unnecessarily, the government would have to resort to rationing medical services. The president of the Pacific Research Institute stated that the independent payment advisory created by Obamacare essentially rations care. It makes us wonder if a smaller version of universal health care rations care, what would happen if universal health care was fully put into action? In review, there are many good and bad results of universal health care. Again, in order to even consider it, we have to understand its impact on finances, quality of care, and businesses. After doing this research, I feel I have given y'all an accurate representation of this impact. Once we are off our parents' health care, we will need to make informed decisions by carefully reviewing our options. So next time you break a bone, get an infection, or get COVID, think about the healthcare you are receiving and how it could be impacted by universal healthcare. Thank you.
Good job.
Good job. I have to show y'all again.